Welcome to an introductory video presented by the Prestige Distance Learning Program. Hello, my name is Florence. I'm the course developer for all of the Prestige education programs. This lecture is part of our cosmetic chemistry specialty classes and based on the principles of corneotherapy. Today we are discussing sun protection ingredients and asking the question, is a sun protection product enough to prevent cellular damage? A great deal of information is available about free radicals, and this term is now extensively used to market skincare products to consumers. What is not understood or talked about is the extent of cellular damage that will compound from the oxidative stress that is a result of radical exposure. Compounded oxidative stress ultimately leads to lipid peroxidation, and the resulting mitochondria damage will mean that conditions like pigmentation and skin cancer become more common and challenging to treat. The different types of radicals caused by heat, light waves, pain, medications, pollution, and air all have varying effects on skin cells. But a typical result of exposure, irrespective of the type of radical, is the oxidization of vitamin C. As we age, cells' built-in protection systems decline. This, along with radical exposure, means a reduction in the balance of the vitamin group that protects us. Vitamins A, C, and E have also become the target of skincare companies, and many varied formulations will contain at least two of these vitamins. The key is in the synergy and understanding that for the vitamin group to protect skin, there must be all three vitamins in the formulation. Water-soluble vitamin C is the first to oxidize and needs to be replaced nutritionally and topically on a daily basis. This is because vitamin C is not metabolized by skin. Vitamin C also reactivates the oil-soluble vitamin E, making it a vital link to the synergy of a cell's defense system. Vitamin E is abundant within the keratinocyte cell membrane. It is, however, a weak antioxidant and can only neutralize one radical at a time before becoming inactive. Vitamin E is entirely dependent on vitamin C for reactivation, and the cell is dependent on vitamin A for support as an alternative oil-soluble cellular antioxidant when levels of vitamin E decline. Fortunately, large quantities of beta-carotene and other forms of antioxidants of the carotenoid group are found within the spinosum layer of the epidermis. Not all of these can be converted to vitamin A, but they play a role in skin barrier defense. Receptors for retinol palmitate are found within the cell membrane, ensuring a steady supply of intracellular retinol and retinoic acid for cellular homeostasis and energy. Another integral part of cellular defense is the 45% phospholipid content of the keratinocyte cell membrane. These lipids can and will be attacked and oxidized by radicals when the balance of the vitamin group is lost or compromised. Intracellular oxidative stress, along with the increasing risk of mitochondrial damage defense, will result. Understanding the domino effect of radical exposure and how quickly the imbalance between the basic vitamin group of A, C, E can lead to the many skin conditions that result is extremely important to the skin treatment therapist of this millennium. Heat and light that is created by UVR and resulting sunburn accelerate the oxidation of vitamin C, a common leading cause of oxidative stress and lipid peroxidation. Varying wavelengths of light result in varying levels of cell damage to different cells of the epidermis and dermis. The keratinocyte, melanocyte, and fibroblast are the cells most commonly affected. It is assumed that by using sun protection ingredients that cellular damage will be avoided during sun exposure. Particulate sun protection ingredients like titanium dioxide and zinc oxide work by reflecting the waves of UVR, offering a physical barrier. The term physical sunblock is a result of that action, and often leading us to believe that a greater protection is afforded to skin as a result. And it is true that zinc oxide will give protection against all of the wavelengths of UVR and some reflection of infrared, heat. Chemical sun protection ingredients absorb UVR and convert the energy of light to heat. It is theorized that this may not necessarily be a good thing because radicals are increased by heat. What I hope you are beginning to understand is that despite our best efforts, the sun protection ingredients, be they particulate or chemical, they only prevent erythema, sunburn, not the radicals caused by heat, light, or air. In fact, they may increase radicals by their action. Here are some options and advice to pass on to customers and patients. Reduce exposure to sun during the hours that increase the risk of sunburn. Prevent sunburn by using a blend of physical and chemical that will give protection from UVB and UVA 1 and 2. Replace vitamin C on a daily basis, and always include the ACE vitamin as the most basic antioxidant replacements. Expand your antioxidant usage to cover both intra- and extracellular types. Protect the phospholipid content of the cell membrane by increasing the use of these types of emollients and lipids. Do not become paranoid or buy into the mindset that sun, light, and air is bad for health, because life will not survive without them. Practice sensible skin barrier defense and preserve the integrity of the epidermis at all times. There are many specialist subject distance learning classes available from pastichetraining.com and many articles to be read. In addition, there are the wonderful books and educational posters available from virtualbeauty.co.nz. I look forward to seeing you in my virtual classroom again very soon. Goodbye for now.